Good evening. During the height of the pandemic, thousands of people were transferred from NHS hospitals into care homes without being tested, a report revealed. And 78 people who tested positive were moved out of hospitals and into care facilities.
But the First Minister says there is no statistical evidence hospital discharges led to Covid outbreaks. Instead, she insists it can be down to the size and characteristics of a home. It's leaving many staff angry and feeling at fault. Laura Alderman reports.
It was a scandal. It was actually inhumane and, in my opinion, is criminal.
Sandra couldn't be by her mum's bedside when she died of Covid-19 at her care home in Drumchapel in April. How the virus got into the home isn't clear, but Sandra has her suspicions.
I know it in my heart. My mum got Covid. There was a patient transferred back into the home on the 16th of March. And that patient was clearly showing Covid symptoms. And within days, staff members were off, and they were all off for the 14 days.
Amond Court care homes say their residence has been Covid-free since May, and they never knowingly accepted any discharged patient with Covid symptoms. On the 21st of April, at the peak of the pandemic, clinical guidance changed, requiring 2 negative Covid tests before a patient could be discharged to a care home. But before that, between the 1st of March and the 21st of April, almost 3,000 patients were discharged to a care home without being tested. Of the 650 who were tested in this period, 78 patients received a positive result and were discharged to care homes. However, the report says there's no statistical evidence that hospital discharges were associated with mass outbreaks. Instead, it says the size and characteristics of a home were important factors, and that's something care home staff are reacting angrily to.
For them now to try and kick it back on care home staff who've tried their hardest with everything else. I mean, the government knew through the other countries that this was coming, Covid was coming, and yet they still never prepped.
Renaissance Care have 15 homes in Scotland and accepted around 70 discharges between March and April.
If the hospital professionals had said to us, this Mrs. Jones is positive, we would have said absolutely categorically no. We would have apologized and said, I'm sorry, but we can't. Doesn't matter how much pressure.
Around half of all deaths related to Covid-19 have been in Scotland's care homes. In May, 10 residents died from the virus at Home Farm on Skye. Their relatives are still searching for answers.
My dad and so many other residents of care homes, patients that were transferred from hospitals, couldn't make these decisions for themselves. And we put our trust in NHS authorities. We put our trust to a degree in the government too. It didn't protect our loved ones from the virus.
The First Minister maintains she didn't know Covid-positive patients were being moved into care homes until she read about it in the media. She's sticking by the report's findings.
I never will shirk my responsibility here. That's why we commissioned this report, to get an understanding. None of this can be in any way diminished, but nor can the conclusion of the report. The conclusion of the report is very clear that it is not discharge from hospital to care homes, regardless of the testing status of people being discharged, that was the significant factor.
Opposition politicians say a review of the whole social care sector is needed.
And this report itself says that there was a risk, and in some cases it was a moderate to large risk, that people then went on to be infected by that. Thousands of people have died in our care homes, and the families of those who perished, they want better answers than what we got today.
Losing her mum has changed Sandra's life forever, and today's report brings little comfort and few answers.
It just makes me feel it's the last thing I think about every night, and it's the first thing I think about every morning.